So what are the different services that you offer?
Well, it all starts with a 3-day process typically in the office.
So 3 days right there in the
3 days
practice.
in the office. There's time spent on the phone, certainly talking with everyone in the practice. It's great to talk to the team members before you go. You learn so much. Talking with the doctors, and there's reference material. First day is pretty much observation. I don't think you can implement anything unless you see what's happening in the practice. Second day is some observation and training. Third day, we're bringing it all together with a great presentation. And it's information, but it's information that's they're helping put together. And that's a part about what the whole team needs. So it's a whole lot of fun. And then there's a report afterwards, some phone follow-up that goes with it. And it can be a great start.
Okay, and the next level now. What about the ongoing?
It's pretty rare that I go in for that kind of visit, that people don't want to do more. They have a team that's energized and ready to go. So for the most part, I have a year, 6 months, year and a half, and there's ongoing visits to the office, and there's also phone support, and certainly there's some material provided in between. But it's helping them take what they've gotten and make it a habit, make it a process that continues long term. And it's so much fun. It's interesting that you see at the tail end, you've got a team that's really making things happen. So they can get so much more accomplished at the end with less time and energy. That's one of my favorite parts.
Okay. Now you're teaching on the telephone skills?
Telephone skills,
case
very
presentation.
Much. Case presentation, yes. So telephone skills, I think, this is the gateway to our practice. And, we look at what's happening culturally in the industry. And I think that if you want to be differentiated, especially if you want to be predominantly fee-for-service, you can't be good on the phone. You've got to be in the top 10%. We need to be better. We need to be the Ritz, right?
Okay.
And so those telephone skills, you've got to look at what's physically happening in a practice. You can't just teach somebody how to do that. You've got to look at making the circumstance effective for them. And I think it's not something that's natural. Once you learn it, it feels really good on the phone. It's not scripted, but it's not something you would naturally know and learn. And I don't think doctors teach it that well.
Okay.
So I do that in an ongoing way. And what I find out is the team members that do this, they have more fun with the patients on the phone. They get more commitment, and the patients come in the door, and they already love the practice. And I think in this world, we've got to be good at that. So case presentation, one of my favorite things to teach. I think what we do in dentistry is changing people's lives.
Okay.
We're at a time where, people are living so much longer. Sometimes I think we don't value enough what we do. We're changing people's lives from 65 to 85. That's a miracle. And so case presentation is about helping people, being good at giving bad news, really. Helping people sort through difficult, complex information in a way they can reach it. One of the things that I talk about a lot is it's not what you tell people that counts. It's really not. I've been married a long time. I know that.
Okay.
It's what they hear. It's what they decide to hear.
Now, when you say bring up bad news, but in a positive way, it means you have problems, but here's how we can.
Here's how we can help you. And a lot of it's about helping people talk through it. So
helping the patient talk through it.
Helping the patient talk through it. We want to vomit information on people. Here's all the things you need to know, what's wrong with you. And I don't know that works so much. So I find people tend to learn well when they're listening.
Okay.
So the skills I teach are about how to present information in simple, small, statements. In fact, my formula is SSS, P, or Q. Short, simple statements, pause, or question. And I teach them to, when you have to give people difficult information, that's what you do. It's a short, simple piece, and you create a process so that patient can communicate back with you before you dump a whole nother load of information.
Okay.
It really makes it easier.
What else? What else are you teaching them in this ongoing?
In this ongoing process? I teach them how to be really good at talking about money and fees and insurance, and to do it in a way that's palatable for patients. I can share with you a small technique. Sure. One of the things we have, I think when patients ask us about insurance, they don't understand the difference between medical and dental. And so I teach people to talk about, for example, that ask your patient what they already know about their insurance, what their expectation is. And then one of the things you can share with them is that dental insurance is different than medical. Medical is great for catastrophic issues, not so good for the small stuff. Dental insurance, it's the opposite, Randy.
Okay.
dental insurance is great for the regular cleaning if you have it done every 6 months and some fillings here and there, but it was never intended for comprehensive care. That's the difference. So in any process, dental insurance is usually
It's interesting.
a
So
little
you
bit of
have to
help.
explain that to the patient.
Yeah, this is a different expectation. And it's if you can get that through in the new patient call and the patient accepts it and embraces it, then they're in a completely different frame of mind when they sit down with the dentist and they're considering and accepting care. They're accepting it from a self-responsibility. So you get less of that stuff at the end about the insurance.